Therefore, I will call this Meriden City Council meeting to order and ask Council Clerk, please call the roll.
Crystal Blake.
Here.
Daniel Brunet. Michael Carabetta.
Here.
Michael Cardona.
Here.
Miguel Castro.
Here.
Bruce Fontanella.
Here.
LaRue Graham. Sonia Jelks. Sonia Jelks. David Lowell.
Here.
Michael Rhodey. Here. Nicole Tomasetti.
Here.
Bob Williams.
Here.
12 present, Your Honor.
12 constitutes quorum. Please rise for the Pledge of Allegiance. Mr. Deputy Mayor.
I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Please remain standing for invocation, which will be led by Councilor Miguel Castro.
Heavenly Father, we come to you today asking for your guidance, wisdom, and support as we begin this meeting. Guide us so we can nurture the bonds of community, grant us the sense of truth, and may we serve with integrity and fulfill our responsibilities as servants of our citizens in this great city. We also commend to your gracious care the men and women of our armed forces at home and abroad, our first responders, police, fires, and EMT. Defend them day by day with your heavenly grace. Strengthen them in their trials and temptations, and grant them a sense of your abiding presence wherever they may be. For this we pray. Amen.
At this time, we are going to make a slight change to the agenda. I do realize it's going to be a bit out of order, so as long as there is no objection from those that are present or calling in, what I'm going to do at this point is I'm going to turn the meeting over to our health director to update not only all of us here, but all of us watching as to what the city's response and mitigation plan has been for COVID-19 or coronavirus. I would like to commend the work of Leah Crown, our Director of Health and Human Services, as well as her staff. I'd like to commend the city manager for his work here at City Hall, keeping all of us informed as to what actually is going on day to day. We have great and tremendous partnerships with Mid-State Medical Center, as well as we were on a call with them just this afternoon and several times last week. So we have a lot of things moving. There's a lot of information. It's very confusing at times because we're getting so much information from so many other departments. So we felt it would be best at this time, since we have everyone together and we have the cameras rolling, to go ahead and allow Leah to go ahead and give us a little background as what has taken place to date, what our plans are moving ahead, so that everyone can be rest assured we are doing everything in our capacity to keep everyone, all of our residents, as safe as possible. So at this time, without objection, I'd like to turn it over to our Director of Health and Human Services, Leah Crown.
Thank you. I want to move this close, but I don't want to move it close. So public health has actually been monitoring coronavirus since December of 2019. But as you can imagine, over the past couple of weeks, it really has ramped up as we are seeing cases now, not only from travelers from those countries where there are travel notices, but now also those in the United States. So over the past month, our office has been extremely busy. Getting like feedback, if you can hear that. Our office has been extremely busy putting a plan into place. We have been working with our regional health directors and put together a COVID-19 response plan. So we do have a formal document that we refer to daily and unfortunately have to update daily as new information comes out to make our decision making. What I can tell people is the information that I give you tonight, I always tell people to please timestamp it. So this is current as of 5 or 6:37. By the time we all leave tonight, some of this information may change. It really has been progressing that rapidly. What I can say tonight is that Meriden has no positive confirmed cases of COVID-19 in our city. However, we are acting as if there was community transmission because really we do have some people that may possibly be walking around with the illness but are well enough and just don't know it. So the guidance that we give to everyone is the guidance that has been out there, and I will review that. But as far as city measures, daily, hourly, I've been in contact with Tim and John Iacovino, our emergency management director, to put together plans and proactive measures in place so we can, as people are saying, slow that curve. Everybody's sort of seen that graphic online now. We want to slow the curve in Meriden. We know we're not going to stop the illness, but we want to keep it out of Meriden as long as we can. And then when we do start to see cases, we want to keep those numbers as low as possible. So what we've been doing are proactive, what's called social distancing measures. It's a proactive public health measure that we know works, keep people separated. So everybody has this document in front of it, but I'll just read it for the public. All events in city facilities have been canceled. The Daffodil Festival in April has been canceled, and we're awaiting word on whether or not a postponement date will be set. The library is closed, and as of today, I made the decision to close our senior center. However, this week, we worked it out with our nutrition program that seniors will be getting a delivered meal by our mini bus drivers, a cold lunch that they can then reheat. And then next Monday, we hope that they have told us that they are going to go to giving us 5 frozen meals that we can deliver to the seniors in the program, so we're only out there once. So seniors will have lunch, a lunch service for the 5 days. For the senior center too, I can tell you we're going to continue medical transportation as long as we can. Other than that, all programs are canceled. And I did tell Tim I may need a bodyguard because I canceled bingo. So we can put that in the budget and set back. I'm meeting with the seniors tomorrow to go over the plan, but we've been prepping them for a couple of weeks now that this may happen. The city also has established a web page solely devoted to city response to COVID-19, so I highly encourage residents to check that daily, as well as the CDC website. If people go on the city webpage, there's a bright red hyperlink at the top that will bring people directly to the page. Tim did announce today that all city buildings are going to be open to the public only from 9 to 2. However, staff will report and be available to do services by phone or over the internet during the hours that the building is not open. We're trying to be very flexible in this, and the city employees have been very appreciative and understanding that this is a flexible situation, it's a changing situation, and we're doing everything we can to keep them safe. Board of Education did close schools. At first, we were only closed through March 30th, expecting to reopen on that day, but the governor's directive now has us closed till the 31st. I have been in contact with Our Lady of Mount Carmel and the 3 other private schools in Meriden, and they are following the public school guidelines. Tim, am I missing anything else? Response?
There'll be a couple of other things I will add
okay.
at the conclusion of your
Okay.
statements,
Wonderful.
Leah.
Thank you. So again, Tim will add those things to that. We all know that on March 10th, the governor declared an emergency, and I believe I know that really frightened a lot of people, right? So, but we want the public to know that by him declaring an emergency gives us as professionals and municipalities and local health directors additional resources and supplies that can be deployed to our state. And these are resources that are necessary to identify infections and slow the spread of disease in our community. So people have probably heard these a million times, but I cannot emphasize enough basic public health preventive actions that we can all take to help spread the disease. They're simple and they work. So avoid close contact with people who are sick. This is the biggest thing. Please stay home when you are sick, except to get medical care. Cover your cough and sneeze with a tissue, then throw out that tissue in a lined container. Avoid touching your eyes, nose, and mouth with unwashed hands. Clean frequently touched surfaces and objects daily, and if people are interested in what products are effective, there is a complete list on the CDC webpage. Wash your hands often with soap and water for at least 20 seconds. It is an oldie but a goodie. It works. If that is not available, please use hand sanitizer that contains at least 60% alcohol. Get plenty of sleep, be physically active, manage your stress, take care of your body, and we always encourage people to still get the annual flu shot. Although flu has dramatically decreased in Meriden, last week I only had 13 confirmed cases. It is circulating still in Connecticut and in Meriden. With that, I guess I'll open to questions.
Want to go first before we take
Sure.
questions? Before we take questions from the council, what I'd like to do is yield the floor, again with no objection, to City Manager Kuhn for additional background information and mandates that will be coming out or have come out.
The primary bit of information that was not included in Leah's report is that meetings all meetings in the city for this week. After this evening, in other words, starting this morning, all meetings of boards, commissions, committees, council, et cetera, are canceled for this week, pending the establishment of an infrastructure to enable us to conduct meetings remotely. The city IT staff has contacted and worked with a vendor. We just have to make sure that it works, that it meets the standards as put out by the governor in his executive order, and a few other items as well. So to reiterate what the mayor said, one of the principal reasons why we are having this meeting tonight is to make sure that we get this information onto onto both our website and our video on demand, but also into the Cox cable system so that people can view this. I just want to point out also that city meetings includes the CDBG meeting scheduled for Wednesday night has also been canceled for this week. Meetings will in general be postponed to another date, but reiterate again, this week they are canceled. Further guidance can be expected well before the close of the week. So that's the principal information that I would have to distribute, Mayor Scarpati. If you can think of anything else that we should add to the discussion based upon the numerous items that we have been in contact with, please don't hesitate.
Thank you. So before taking questions, these decisions and guidelines are not made in a silo. These are not made, while they are local decisions to many extent, we are making sure we are on the same page with others. So I know that Leah, Tim, and myself have been on revolving phone calls that include calls with the CDC, the Connecticut Department of Health, the governor's office, of which we were just on a call with, HUD, that was also a call today, as well as White House staff have issued calls, among others. So these all help make the decisions that have been implemented to date. And these, as Leah said, are ever-changing and are evolving. And so we will do our best to stay ahead of it. We are going to try as best as possible to use Belen, our communications specialist, through social media, our website, to keep that updated as frequently as possible and as accurately as possible, so that members of our public, who I know are also live streaming in tonight, can be as informed as possible. So with all of that being said, if there's additional questions, comments, or concerns, well, I see the city
Just one
manager's
quick
hand up.
comment.
Yes, sir.
I just want to advise all the people present that this facility was sterilized before the use, or sanitized, excuse me, not sterilized, sanitized before use to include chairs, surfaces, et cetera. And I would urge the public that is present to please maintain your distance from one another. We did provide hand sanitizer for you as well. And as we go forward with the public comment, there's also there is a can of sanitizer up there. I would ask that you please, when you come up, please wipe down the podium and anything that you may touch in the area. Mayor Scarpati, that's all that I have at this time.
Thank you. Questions, comments, concerns from members of the council for either the health director or the city manager? No questions or comments at this time. Councilor Williams.
Yeah, I'm not sure if Leah or Tim can even answer this. Do we have any idea when the test kits are going to be available? Has there been any communication from the state or the federal government on that process?
I would just state that testing is happening, and specifically today has ramped up drastically. So we are working with Mid-State Medical Center on increased testing over the next couple of days as well. They are partnering right now with LabCorp, which is a private lab that will be sending the test results to, or sending the sample swabs and whatnot, so they can test them that much faster. There will be probably a 24 to 48 hour turnaround for those tests. So expect over the next several days, as we have over the last few days, cases in Connecticut are on the rise, and they are on the rise not just by a couple. We are doubling the numbers almost every single day, so we expect that number to increase likely in our community as well.
Leah, would you address specifically, I think it'd be more important coming from the health director, about how citizens obtain a test?
Sure. So right now, the CDC is not recommending testing those without symptoms. So right now, there are two ways that people can get tested. One is if they are sick and they are hospitalized. Then a test will be given by the healthcare facility, or if they have come in direct close contact with somebody who is known to be positive for COVID-19. Those are the two main reasons why people are testing right now.
And the only way that you're going to get a test is through a physician's order.
Right.
So you must, I repeat, must go through your physician to get access to a test at this time.
What I can say is our office has been inundated by phone calls from people believing that they were in contact with somebody who's positive or has a relative that works with someone who went for a test. Our guidance for those people who are concerned is that they need to contact their healthcare provider. They're calling our office, but we are not a medical professional. So we have to turn around and say, all right, based off of your risk exposure, your doctor can make the best determination whether or not you need a test. If the doctor's not available, Hartford Healthcare has set up a hotline number. It is available on the city's website. That is 24/7, staffed by medical professionals. So we're referring people to that hotline as well.
Just another follow-up question. Do we have any kind of a timeline on when CVS, Walgreens, Walmart are going to be ready to do the monitoring as well that the president talked about? Has there been any dialogue at that level?
No, I can't give you a timeline, no.
All right, thank you.
Do you happen to have the number available, Leah, for Hartford Healthcare?
I wrote it right on the inside here. So the number for Hartford Healthcare, this is the toll-free number, is 1-833-621-0600.
We urge any residents who have questions to contact that number. I say again, 1-833-621-0600. Please contact that number. They have medical staff available to answer many questions that you may have. It's a very useful and powerful input into the medical system.
Thank you. Other questions from council? Other questions from council?
Can I ask a question? This is Sonia.
Yes.
Do we know what services are open and available citywide? I know the state has issued services that are closing. Are there any services in the city that will be closed or available?
Right now, the only services that are closed to some extent is the senior center and the library to some extent. There are staff in both locations that can answer questions by phone, but the rest of the city, as indicated earlier, will be open to the public from 9 to 2 at this time, starting tomorrow. Again, open to the public from 9 to 2. We are encouraging the public to call, email, use online capabilities if at all possible. And please, if you have a fever, if you have a cough, do not come in for services. First of all, we will ask that you not enter the building, and you do not want to expose yourself or anybody else to possible infection with the COVID-19, with that virus, the coronavirus. I believe that answered your question,
you.
Sonia.
It did. Thank you.
Any other questions? I did forget we had counselors on the line, so any other questions, counselors, if you have them on the line, please unmute and say so. Otherwise, we will move forward with our agenda. Any further questions? Any further questions? Hearing none. Leah, once again, thank you. I know it's been a trying few weeks.
Yeah, I've been heavily caffeinated, I can say, the last week, but it's been good. Again, I'll reach out with any updates. Again, the city website, but everybody knows how to reach me. It just may take me a little bit longer to get back to you these days. So, but thank you.
Thank you very much.
Somebody tell us about the lunches for schools, for the kids?
There are sites. There are sites across the district for. Yeah. So the question was, what are our sites for the free lunch program, free breakfast and lunch programs for our school district? I do know that the Lieutenant Governor is coming in tomorrow to kind of take a look at our sites, as we are one of several municipalities handing out lunches. I think we did over 700 lunches and/or breakfasts today alone. So this was our first day implementing that. The sites, I know it's Lincoln. Do you have the sites? Thank you for pulling those up.
Okay, so the lunch sites were, and I believe they're going to be moving forward, are Maloney, Washington Middle School, Lincoln Middle School, Seppa Field, Habershon Park, the Meriden Green, City Park, and Columbus Park. And those meals are available, I believe, from 11:45 a.m. to 12:30 p.m.
Thank you. All right, hearing nothing further, we'll move to our next item on the agenda, which is public input. Just a reminder that public input is limited to 3 minutes per speaker. We have 2 speakers on our list. First, Mr. Dan Zaborowski.
Dan Zaborowski. I'd like to give the high five to all our doctors, nurses, our health director, everybody who's, but the high five is just a shadow. But again, these are the people that are working with us. The caregivers in our convalescent homes, they're out there. They've closed a lot of the convalescent homes down, quarantined them, and it's a good thing, and we're working hard, and I see, the effort that's being put around through the whole state as well as the United States itself. But tonight I'd like to touch on a couple of things. First of all, the mayor's consolidation. I think a couple of people were a little upset to consolidate committees. Well, I was on 3 committees: cemetery, ADA, and the parking and transit. And in time, a lot of these meetings were canceled. Nobody wanted to show up. And I think the mayor hit on a good point in regards to the consolidation, and I hope the council goes along with it, because again, this is something, people are involved, I'm involved, and other people are, and I just want to keep it that way and hopefully solidify this. And I know the mayor has some of the appointments tonight that he's bringing forward to. But 2 things in particular: the blight in Brownfield and our personnel. We got to get these reports on the city websites. It seems as though a lot of the committees are not putting their reports on the website. So consequently, people who can't attend meetings cannot see this. Got to be a little more visual and put out these reports and get them done, because without that, I do not see, and I'm not attacking him personally, but I don't see our economic development director at any of the planning commissions or our communication specialists pushing these things. I do go to him. I do speak my piece like I did at Tacos Mi Nachos. Here's a man's going to put a restaurant in the city of Meriden. I didn't see anybody there. But one little subject I'd like to touch on is a custodian who just retired in the Board of Education. He is now going to be hired as a consultant. Double dipping? Yeah, I think so. But again, why do we bring people back in? I know there's another one, and he works on the electric in the city of Meriden. He retired. He's brought back another job capacity. What we need to do is stop hiring. Let's get our debts paid off in the city of Meriden and look forward to hopefully now being able to, with our capital improvement, get them done. We need to get a lot of that stuff done. A lot of stuff is just antiquated and just borrowing money, keep borrowing money. I know that they want to change it up to 5%. $5 million. It can't be done. Thank you for your time.
Thank you. Reverend Ernestine Holloway.
Hello, Reverend Ernestine Holloway, Britannia Street. I want to thank all the officials for what they're doing during this time. It's trying, it's awful, it's confusing. You know, nobody mentioned transit. Are the buses running? Are the trains running? Are they running on Saturday schedule? These are things that the public need to know. I take the train. I'd like to know, is it going to run on a Saturday schedule or on time? How are they handling things? What are we to do when we get to the station? These are things that I'd like to know personally. So I know if I want to know, the public wants to know. You know, I understand that you're going to have food for the kids at 11 o'clock. So are they going to eat breakfast at 11 o'clock? Or are they going to come in the morning and eat breakfast? Are they going to come back and get lunch? Or are you going to give them both at the same time? You know, we need more details. You know, I don't understand how the stores are operating. Why are we closing restaurants? Or if we're closing restaurants, these are the questions that the publics have. It's a lot of confusion out there. So maybe as a city, we can clear up what's happening in Meriden. And if there are any restaurants opening, can you go pick up food and just not eat there? These are things that we need to know. You know, good direction. I'm not saying everybody's going to follow it, but you know, you can put it out there. Ounce of prevention is worth a pound of cure. You know, I don't know what parents are going to do with those kids, because I know when I was a mother, I looked forward to kids going to school. That's our break time. Now you're stuck with them for 2 weeks. You know, is there any online things that a parent can do? You know, did we look into any of that? You know, they have museums sometimes that have online schedules. You know, we got to do a little bit better. I understand it's short notice, but we got to help the moms out, because I know they're going crazy. And I do want to say thank you again, because I know you guys are in a tough spot. And does this apply to RTC meetings, other meetings around the cities that weren't mentioned? How does this apply to them? How does it apply to churches? These are things that we have not addressed. So I, with the health person here, Ms. Leah, and the city manager, maybe we can talk about that. You know, if you go to Cumberland Farms, you might not want to hang out there. You want to leave, get your stuff, and go. What are the guidelines that the public needs to follow? Thank you.
Thank you. Other members of the public wishing to speak? Other members of the public wishing to speak? Hearing none, I'm going to move to close public input, and given some of the questions that were brought up and the fact that obviously this is a state of emergency, and it's unlike other times where we don't typically respond to members of the public who raise issue or question in their comment, but I feel that without objection, once again, from the council, and if there is, just raise your hand, I do feel it's appropriate to respond to at least maybe clear some things up that have been out there in the media, on social media, because first and foremost, many of the restrictions and orders that we are following are well beyond decisions that are happening in this room or even in this building. They are coming down from either the federal government or mostly the state governor's office, setting out executive orders. And those executive orders, many of them come with imposed fines and other things that not only municipalities can face, but members of the public can face if you do not abide. So that is why we are doing our job to just urge you to not meet. The governor did state that groups that while most recently it was 50, the president stated 10 today, to avoid gathering, do include churches, or the list does include churches. You know, private organizations, we can just ask you to heed the warning. I will yield to Director Crown if you'd like to add anything further about some of the questions that were asked and why we are following some of those mandates.
Sure. Regarding the question on breakfast, and Michael, correct me if I'm wrong, but the students are getting lunch and then next day's breakfast in one package. So the next day they'll get lunch and then the next day's breakfast. So they are getting breakfast and lunch in that packet. Regarding the restaurants, last night governor phone call, 6 o'clock. We're going to work together with New York, the tri-state area. At 9 o'clock this morning, that went into effect. So what it means is that as of 8 p.m. tonight, restaurants will be limited. I hate to say that word closed. They're not closed. They're limited to takeout or curbside pickup only. So, and then bars that do not serve food will be closed, as well as all the gyms, all of the cinemas, the theaters. And I'm blanking on the others, I'm sorry, it's been a long day. But the guidance is on our website. My staff, we are not suspending food service inspections. Now is the time to be diligent with those. So staff is going to continue to go out and do the restaurant inspections to make sure that people are washing their hands, there are no sick employees at work, that all of the sanitizing and disinfecting solutions are at the levels that they're supposed to be. We actually went out to all food service establishments today and hand-delivered letters with this information, and we had it all stuffed, ready to go, and then the governor's directive came out, so we stapled that to all the envelopes and hand-delivered those messages to people. We have also been giving guidance to all of our daycare facilities, the CDC guidance. All of our faith-based organizations have received the guidance. I did make a couple of phone calls to some churches today that probably were not just aware of the new they were still stuck on that 250 number that had come out, but we instructed them that the new recommended number is 50, and to encourage members of their congregation to do online if they can, watch services online, and I can't remember if there's anything else from your question. If I missed anything, please feel free to chime in.
Those are all I remember.
If you could just clarify, one thing that's, I think, somewhat unknown or is confusing is there's obviously going to be, after 8 p.m. today, a restriction on bars and restaurants for takeout or pickup. But it's also my understanding that as of 8 p.m. each night, those establishments must close.
The governor's conference call today at 5 says there was no curfew in place.
But a closure would take effect, or no?
It's my understanding, Tim, correct me if I'm wrong, today at 8 p.m., these new rules go into effect.
So it's not that they close, it's just that...
It's when the goes into effect, was my understanding as well.
Mm-hmm.
Okay, thank you. Councilor Castro.
Thank you, Mr. Mayor. And it's a matter of reiteration regarding the breakfast and meals. And I will echo the Deputy Mayor's comments and information. The Meriden Public Schools will be offering what they call the grab-and-go breakfast and lunch at no charge to everyone under the age of 18 that is part of the student population in our school districts. This will be available Monday through Friday, beginning March 16 until school reopens. Also adds that they can visit any of the sites that were mentioned by the Deputy Mayor. Families will grab the day's lunch as well as the next day's breakfast, as the Director of Health have mentioned, to eliminate the needs to multiple pickups. Families will not be permitted to remain on the premises to eat. Now, all K-5 supplemental learning packets and 6 to 12 online learning options will be available at the meal sites, and they're also available at the Meriden Public School website. And this is as per Dr. Benigni, the Superintendent of Schools in Meriden. Thank you, Mr. Mayor.
Thank you. City Manager did ask to...
The other question was regarding transit. I don't have information regarding the buses, but the trains are moving to a Saturday schedule. So the normal Saturday schedule will be in operation at this time. We'll see if we can add see if there's any change in the transit buses schedule, and if so, that will be posted on that same website that Leah has mentioned earlier as well.
But again, as the governor stated on his 5 o'clock call tonight, almost verbatim, if you don't have to get on a train, if you don't have to use public transit, don't. Leah.
Just like to mention one more thing, that some supermarkets and stores might be changing their business hours to allow time to clean and to restock the shelves. So if people do plan on going out to the supermarket, just to maybe call ahead to see if they're open. But really, it's daytime hours. They're eliminating some hours in the morning and at night to make up for stocking and cleaning.
Thank you. Further questions, Councilor Williams?
Yeah, I just want to be clear. So bars close tonight at 8 p.m. and they do not open. Is that correct?
Bars that do not serve food, yes.
Correct. And they stay closed until there is a change at the state level, correct?
Correct, yeah.
Thank you.
Yeah.
Counselor Blake.
I just want to make a couple comments, touch base on the Board of Ed aspect. So there's been a lot of information given to any parent following the app. The Board of Ed, from superintendent all the way down, has been very informative, sending information, allowing parents to go to schools to pick up either Chromebooks or packets. And every teacher has been in contact with parents, so the kids are able to get all of their work either online virtually or hard print copies, and also at the schools and where the food sites are. So they have addressed that also.
Further questions or comments? Further questions or comments from council? Further questions or comments from council? Hearing none presently or on the line. I once again thank you, Leah, for everything, and I'm sure there'll be more communication to come. Our next item on the agenda is City Manager's report. So I yield the floor to Mr. City Manager.
The city manager's report has already been conducted.
Perfect. Excellent. Best report yet.
You got it.
Next item on the agenda
Semper Gumby.
is the setting of the consent calendar. Are there any changes, Mr. Majority Leader?
There are no changes. Motion to adopt.
Second.
Motion made and seconded. Any discussion? Any discussion? All those in favor?
Aye.
Opposed?
Aye.
Next item is the approval of minutes from March 2nd, 2020. Do I have a motion to approve?
Yes, Your Honor. Motion to approve.
Second.
Motion made and seconded. Any discussion? Any discussion? All those in favor?
Aye.
Aye.
Opposed? So moved. Next item, Council Clerk.
Item number 11, your Personnel Committee, to whom was referred a resolution concerning new position of Deputy Fire Chief, be established. Report they have attended to the matter and recommend adoption.
Council Castro.
Make a motion to approve committee report.
Second.
Motion made and seconded. Discussion, Council Castro.
Thank you, Mr. Mayor. As we all know, the fire department administrative staff consists of two individuals, the chief and the deputy chief, to manage the second largest city department. And the fire department administrative structure has not changed in 20 years. As per the fire chief, this is a position that he's been asking for quite some time, and have been able to really explain and highlight the reasoning why is his ask. The services demands, complexity of response, training requirements, logistical requirements, technology, and other administrative responsibilities that have grown considerably over the time frame. The fire department continues to strive for the safe and efficient operations of the department, ensure that an administrative level chief officer is available for respond to complex emergencies. Now, that new position of deputy fire chief will then change the structure in the administration that is currently in the fire department from 2 to 3, which means that the fire chief and 2 deputy chief. Now, this is on the size of our city compared with other municipalities of our same size and fire department size, like Wallingford, East Hartford, and Milford. They all have 2 deputy chiefs and a chief. This has been discussed at length at the Personnel Committee. It has been both supported by the Personnel Director and the City Manager, and it was voted 3-1, and I urge adoption.
Thank you. Any further discussion? Any further discussion? Mr. Minority Leader.
Through the chair, is this going to finance now, or is this being voted on as such?
I believe I was under the impression there was going to be a motion to refer to finance.
Okay. So comment prior, I was a nay vote earlier. It was a 2-2 vote at the original Personnel Committee meeting. I don't feel we should be adding any head count at this point. It's a department with 105 individuals. You have 16 lieutenants, and somehow, some way, the chief should be able to fill any type of position without adding head count. This does add head count. It was not a promotional opportunity from within the organization. Thank you.
Thank you. Further discussion? Further discussion? Before I call on, Counselor, before I call on you, there is some noise coming from the line. Is this because someone on the line wants to ask a question? Okay, hearing none. Mr. Majority Leader.
Thank you, Your Honor. And yes, I was conferring with Corporation Counsel just on the point of the minority leaders that I would make an amendment to the committee chair that predicates the adoption of the committee report, which is an approval of personnel with a referral as part of the action to the Finance Committee. If we can amend the action to be the adoption of your committee report with a referral to Finance, I would make that amendment.
Thank you. So we have an amendment on the floor and a second to refer the Personnel Committee report to Finance. Further discussion. We are on the amendment which would refer to Finance. Councilor Williams.
Yeah, I'm going to refer to the deputy mayor as well. Should this not also be referred to public safety? I think it should.
I think the merits of the discussion in terms of the position were presented by the chief and the deputy chief today on 2 separate occasions. So I think it would be redundant to present at the Public Safety Committee meeting. That's just my opinion.
Further discussion? Further discussion on the amendment which would refer to Finance? Hearing none. All those in favor?
Aye.
Opposed?
Aye.
Oh, that's right. I'm sorry. I should call for a roll call vote for those on the line. So this is a referral to, this is an amendment to refer this to Finance. If I could just look for a roll call vote, Counselor Graham?
Aye.
Counselor Jelks?
Aye.
Counselor Tomasetti?
Aye.
Counselor Rhodey?
Aye.
Okay, let the record state, all on the call voted aye, and in the room voted aye. Any opposed? Okay, hearing none, the amendment, now we stand on the resolution as amended. Is there any further discussion on the resolution as amended? Further discussion? Further discussion? Hearing none, all those in favor?
Aye.
Aye.
Counselor Graham, aye. Counselor Jelks?
Aye.
Counselor Tomasetti?
Aye.
Counselor Rhodey?
Aye.
Any opposed? One opposed. So moved, motion passes. Nothing further on the agenda for upcoming meeting dates or announcements. Upcoming meeting dates or announcements. Counselor Williams.
Yeah, I just want to advise the public that the American Legion, we've taken precautionary measures with this coronavirus out there. We will be canceling all of our activities through April 15th at this point at the property, both meetings, any indoor or outdoor activities. So again, there is no activities for the next 30 days minimally. Thank you.
Thank you. Mr. Majority Leader.
Yes, thank you, Your Honor. And I just want to emphasize the cancellation of tomorrow's Economic Development, Housing, and Zoning meeting because this is new. It was mentioned at the beginning of our meeting, but it was also the subject of a public hearing on a zoning matter. So I want to emphasize the closure for those that may be watching this if it is posted in time. But spread the word. Thank you.
Upcoming meeting dates or announcements. So we obviously are in the midst of the budget season in light of not only the coronavirus and the fact that we are suspending meetings. We were also granted per the governor's executive order over the weekend. He did grant municipalities a 30-day extension on budget timelines as well as hearings. So that does give us some time and some flexibility to not have to try and hit all the meetings in such a tight of time frame. So Councilor Rhodey, if there's any further announcements from the finance side of it.
We're going to wait to see what virtual platform will be developed that we can maybe do our next meetings through that platform.
Okay, thank you. Any further meeting dates or announcements? Very good. Hearing none, I wish the public, all of you at home, all of you in attendance, nothing but the best health. Please stay involved and engaged in our social posts and website, as we will try and keep you all as informed as possible. With that being said, do I have a motion to adjourn? Motion made. Do I have a second? Motion made and second. All those in favor?
Aye.
Meeting adjourned.
Thank you all for being online tonight and this experiment in democracy in action.
Has left the conference.